Hello all, typical action potential. In this video, we are doing 10 components along with ionic basis of it. Initial components are also called phases of action potential, depolarization and repolarization. We are using this diagram. So on vertical axis of this graph or diagram, we are having potential in millivolt. Important values are plus 35 millivolt, 0 millivolt, minus 75 that is firing level, and minus 90 that is resting membrane potential. On horizontal axis, we are having time in millisecond. Whenever to an excitable tissue, an adequate stimulus is applied, its potential changes. This is called local potential. If local potential reaches to firing level, that is minus 75 millivolt, then our first phase or component happens, that is depolarization. And this is because of sodium influx through voltage gated sodium channels. These channels open fast and close fast. So at 35 millivolt, these channel close and voltage gated potassium channels open. This channel causes potassium efflux that is responsible for our second component, that is repolarization. Initially, repolarization is rapid, but eventually, because gradient, both electrical and concentration, decreases, rate of repolarization also decreases. This leads our third component after depolarization. This is slow phase of repolarization. And then, because potassium channels are slow closing channels, potassium efflux continues even after minus 90 millivolt, that is RMP, and that causes hyperpolarizing phase of action potential. This is our component number 4 after hyperpolarization. Then recovery happens due to sodium potassium pump. Component number 5 is overshoot. This is part of action potential above 0 millivolt. And then component number 6 is spike potential. As the name suggests, it is rapid part. It is rapid depolarization and rapid repolarization, spiked part. When electrodes are implanted, some current leaks and baseline fluctuates. This causes our component number 7, stimulus artifact. Component number 8 is latent period, time period between application of stimulus and onset of response. Point number 9 and 10 are respectively absolute and relative refractory period because of inactivation of sodium channels. So, friends, we have done these 10 components. Thank you so